Hi, I'm Dr. Dan Monti. Today we're going to talk about a remarkable intervention that's been recently shown in a clinical trial to help people with chronic pelvic pain. We have a top expert in the field who was part of that study to talk to us today and also to teach us how to do a little bit of it for ourselves. Stay with us to the end so you can benefit from this intervention yourself. I'm here with Dr. Tobia, who's a licensed clinical psychologist and a top expert in mind-body medicine, particularly a mind-body therapy called the Neuro Emotional Technique. And she's the lead interventionist on many of the clinical trials on the Neuro Emotional Technique. And she also teaches in our master's degree program, which features the Neuro Emotional Technique. So Dr. Tobia, it's really a thrill to have you here today. Welcome.
Thank you so much. I'm so excited to be here with you and talk about this amazing technique and the studies that we've been working on.
Well, one of the things that I wanted to really jump into is there was a very recent publication on using the neuroemotional technique on patients with chronic pelvic pain. And this is really interesting because that's a group of people that has very limited options. And the people in this study have been struggling with this pain for a long, long time. Tell us a little bit about this group of people that you were working with on this clinical trial.
Yeah. So it is an incredibly stressful condition because it impacts so many different areas of your life. And the women that we worked with had pelvic pain for years. These women were really struggling and suffering in tremendous pain, and nothing could really touch it or get it under control. They had different options, shots, injections that would work for a limited period of time, but didn't really get to the depth of their pain. And this, when you have pelvic pain, so for the study, the patients had a range of conditions. There were things like vulvodynia, endometriosis, fibromyalgia, labral tears, difficult deliveries. There were a number of conditions that all contributed to pelvic pain. Some had one of those conditions, some had multiple conditions.
And on average, how long did these women have this kind of terrible pain?
At least several years. They had been struggling for a long time. It's so interesting to see the number of ways that a similar pain pathway can impact your life in so many different ways. So for example, for some women, standing was really painful. For some women, standing in the kitchen, cooking, going up and down the stairs for some women was almost impossible. There were women who had to sit on ice for hours if they were driving. There were people who couldn't have sex with their partners. There were some women who weren't married yet who felt like they'd never find a partner because they felt so damaged and so broken from everything that they had been struggling with. There were women who had incredibly difficult pregnancies, incredibly difficult periods, or menstrual cycles. There were women who suffered wearing pants, wearing anything with an elastic waistband, wearing underwear. It's incredible the number of ways that this can impact women's lives. And it was so difficult because there really wasn't anything that helped them. And when you have pain, you not only have pain, but you also can develop anxiety and depression associated with the pain because the pain is so debilitating and it impacts so many areas of their lives. Like for so many of these women, they look perfectly fine. Looking at them, you would have no idea anything was going on. And it was so deeply personal. This is such an intimate issue that they didn't feel like they could talk to people about it. So it also led to a tremendous sense of hopelessness and isolation, loneliness, even separated from their partners who felt like they couldn't understand why they couldn't have sex or why they never wanted to be intimate because it was so painful and uncomfortable. People would talk about how it was like giving birth to a porcupine, or that sex felt like repeatedly poking a sore spot. There was such a tremendous amount of pain associated with activities that should be associated with pleasure.
That's a lot to deal with.
It was a lot to deal with for these women. And what happens when you have pain is that when you have pain, you have the pain for the time you have the pain. But when you have anxiety and stress then about the pain, you can have that all the time. So for women, they might have had pain when they were sitting in the car, let's say. But then they have the anxiety and the stress about the pain while they're thinking about, oh, can I take this drive to go see my sister? What if there's traffic? What if the drive is difficult? What if I'm in the car longer than I anticipated? So they then also have this anxiety and stress about the pain that carries over and impacts their functioning. The average amount of time that the participants had the pain was about 3 years, but for many, it was much longer.
So why was the Neuro Emotional Technique chosen for this group of patients that really have a complex pain disorder and a lot of need?
One of the wonderful things about NET is that it's incredibly efficient and powerful. It really directs the person to the deepest part of their struggle, the deepest part of their problem, and then helps them resolve it quickly. So in just 3 to 5 sessions, in each session lasting about 45 minutes, so just in a handful of hours, these patients were able to get dramatic improvement in their care.
And were they also getting just their regular medical care along with the NET? Like, they didn't just stop seeing their doctors or things like that, right?
Well, they continued getting their standard medical care that they had gotten for years. But what happens is when they had done the standard medical care, they had hit sort of a wall. They'd had the amount of improvement they were going to have, and that improvement had stabilized. They were there and they were sort of stuck there. And so what NET was able to do was sort of unravel that and get them to the next level.
So what were the results of this study of NET with this pain population?
The results showed that the patients had significant improvement in their pain. They had a decrease in pain,
Wow.
They had an improvement in their quality of life, the way they saw the pain and their relationship to their pain improved, and they also felt less depressed, less anxious, and had improved overall quality of life. Their relationships got better, their mood improved.
In just 3 to 5 sessions.
In just 3 to 5 sessions. It's really remarkable.
And I know the study, because I was part of it, looked at brain activity. Let's talk about that, how that changed.
It is so exciting when you have a study where you can actually look inside the mind and see what's happening, that you can actually measure the way the brain perceives pain, responds to pain cues in the body, and thinks about its own pain.
Yeah, what's really great is this was functional MRI that was done, so it really looks at the functional activity of the brain pre and post, compared to people who didn't get the NET and had that same kind of chronic pain. And the way the brain interacts with the different parts of itself was dramatically different.
And the way one part of your brain talks to another part of your brain, that they can even measure that is astounding, and that they can measure differences and how the brain talks to itself and understand that, it's amazing. And they were able to see that when you do an intervention like this that really targets the mind and the body, and that you're dealing with the emotions and the physical aspect at the same time, and that when you do that, it actually changes the way the brain functions at a very deep level.
So I know the data shows, and I encourage everybody to read the study, but what I didn't have the benefit of, since you were the interventionist, is to really see the difference in the people pre and post. So there's the data that says they improved. What were they like?
You know, it's so interesting that you asked that, because you can see these brain scans and they're so different when you look at the scan and when you look at the pictures of the brain scans. But to actually talk to people and sit with them and hear the kind of changes that go on in their lives, it's remarkable. Women who had never been able to have sex without pain, able to have intercourse and have pleasure and not have to dread having sex with their partner. It was funny, you know, some of them would say like, oh, my boyfriend wants to know what you're doing, and he asks you to keep going because they could finally enjoy and relax into the experience of intimacy. For many women, even just arousal was painful. So they really couldn't participate in any kind of sexual activity without tremendous pain. Some women were able to drive for the first time without having to sit on ice or to have to get up and stop every hour. There were people who were able to walk and actually exercise for the first time in years. There was some people who had trouble sleeping from the pain. And when you're not sleeping, your body isn't entering a healing state. It doesn't get to relax. It's so stressful to not sleep, wake up constantly in pain, trying to find just the right position. So being able to get resolution for that and an improvement in that was remarkable. There were some women...
Such powerful stuff. Wow.
It's so exciting, and it's so exciting to get to be a part of it, to get to see them on this journey and see the progression in just a handful of weeks. I mean, we did one session a week, so for some of these patients in just 3 weeks, 5 weeks, they felt significantly different. And it was so fun to be a part of with them. And one of my favorite moments was when at the end of the treatment, one of the patients said to me, "I can't remember a time when I felt this good. I wish I could take this treatment with me everywhere and that everyone could get to try this because it's that powerful."
That's incredible. And of course, the intervention does allow them to take it with them because I know that you teach people how to continue the work you do with them in person.
Yes, absolutely. There are steps that they can utilize at home so that they can use this for all future stressors, all things that go on in their lives, not even just about the physical pain that they experienced, but other struggles and other difficulties that they had in their lives.
Wow, that's tremendous. So Dr. Tobia, I know the NET protocol is very involved, particularly when you're getting at those deep-rooted issues, and there's a lot of mind-body techniques that you do in the full NET protocol. But are there some techniques in NET where people can do some of that stress reduction on their own, sort of like when people do mindfulness on their own?
One of the things that I had the study participants do, and that I actually use with my own patients, is a quick stress relief technique that I think you'll find very powerful. So I want you to think about something in your present day that's stressful to you. Maybe something that happened with your boss, or getting the kids to brush their teeth in the morning, or some bad dream that maybe you had, just something that's stressful in your life. And I like to have my patients, and in the study I had them rate their stress in the present day on a scale of 0 to 10.
So whether it's the pain of a headache or an interaction I'm having with someone that's bothering me, how stressful that is to me, I put it on a 0 to 10 scale.
Yes.
Okay.
And it can be, and it's your scale, so it could be not what somebody else thinks, but however stressful it feels to you. And I want you to think about...
All right, I'm thinking of a good 9 here. Okay.
Excellent. And I want you to think about what's the most stressful about it and what the feeling is that it kind of brings up or elicits, whatever the emotion is that goes along with that stress. Not just stress in general, but what the feeling is that you get when you think about that situation.
The emotional feeling, like angry, sad.
Yeah, helpless.
Got it.
Something in that category.
Yeah.
And then you're going to put your one hand on your forehead, and we'll do both sides. So it doesn't matter which side you start with. And you're going to take the palm of the other hand and put it where the face of a watch would go, and just curve your fingers around. You don't want to grip your wrist tightly, but just light pressure. And then you're going to put your hand on your forehead.
Because you want these fingers touching where the pulses would be.
Exactly, where these pulse points are. And you're going to put your hand on your forehead and close your eyes, and you're going to take slow, deep breaths. Now, I like to rest my elbows on my legs or my forearms. If I have a desk, I might rest my elbows on the desk. And you can even do it on the side of your chair. And close your eyes and take slow, deep breaths in and out. And just allow yourself to feel the stress. Notice where it is in your body. Maybe there's a physical pain that you're feeling, like a headache or a low back pain that you want to focus on. And you can just focus on the stress of that. And just breathe in and out until you feel your body relax. And it'll usually take about 30 seconds or so. And then you can drop your hands and come up and do the other side and do the same thing on the other wrist. So hand on your forehead, hand on your wrist like this, and close your eyes and just let yourself feel whatever emotion is there. And it may change when you switch wrists, and you may notice something else or a different feeling that goes along with it, or that you notice it in a different part of your body, and that's okay. That's completely normal. And take slow, deep breaths until it shifts. And then you drop your hands and come up, and then you can rate again and notice, has it changed in that scale of 0 to 10? Where are you now, and what's different?
Well, I already noticed a difference, but
it does work quickly.
I'm an NET fan, of course, as you know. You might have said it. About how many breaths do you do on each side? It sounds like 4 or 5 on each side.
Yeah, about 4 or 5 breaths. You know, something under a minute is about how long you want this to take. So it shouldn't be something that you spend a lot of time on. It's just something quick to help your body relax.
And can you do it a couple times a day?
I like patients to do it in the morning and the evening before bed, just to sort of clear out the day. But you know, it's also great if you wake up in the middle of the night and you're having trouble getting yourself back to sleep, because sometimes the mind wakes up when it really should be sleeping. And so it's just helpful to kind of quiet things down, to settle down those thoughts and help you get back to sleep.
Well, I know it really works, not just because I saw those study results, but because I've seen it myself. And so I'm so happy you were here to talk to us about it today. I always learn something from you. Thank you so much for being with us, Dr. Tobia. Really appreciate it.
It was wonderful to be here with you. This was so much fun, and I'm happy that we were able to talk about such an amazing technique and the incredible results these women were able to experience.